Good morning, everyone. My name is Deepa Shah Patel. I'm the director for the Nutrition and Physical Activity Program at the LA County Department of Public Health. Thank you so much for joining us today for the release of the Department of Public Health's report, Sugar-Sweetened Beverage Consumption Among Children and Adolescents in Los Angeles County. Before we begin, we want to take a moment to thank the LA County Board of Supervisors for adopting a motion 2 days ago in support of this report, its recommendations, and its widespread distribution. We also want to thank everyone involved in creating this report, including our department's Office of Health Assessment and Epidemiology, and as well as our Nutrition and Physical Activity Program. The report draws from the Los Angeles County Health Survey and summarizes the ongoing threat that sugar-sweetened beverages, or SSBs, pose to child and adolescent health. And for context, sugar-sweetened beverages are defined as drinks that are sweetened with various forms of added sugar, like regular soda, fruit drinks, sport drinks, and energy drinks. The report evaluates data from 2007 to 2018 and specifically highlights variations and trends by racial and ethnic groups across 8 service planning areas, or SPAs, and 26 health districts. The report also looks at sugar-sweetened beverage consumption by participation status in the Special Supplemental Nutrition Program for Women, Infants, and Children, also known as WIC. The data from the survey includes a representative sample of approximately 8,000 adults and 6,000 children. Interviews were conducted in multiple languages, including English, Spanish, Chinese, including Mandarin and Cantonese, Korean, and Vietnamese. Looking at the data, we found that demographic and geographic health inequities continue among Los Angeles County children and residents. In LA County, approximately 1 in 3 children aged 17 years and younger, or 840,000 children, consumed at least one sugar-sweetened beverage on an average day in 2018. In 2018, sugar-sweetened beverage consumption was higher among Black and Latino children at 47.6% and 43.1% respectively, compared to Asian and white children at 25.4% and 21% respectively. To put this simply, over the past decade, while rates of sugar-sweetened beverage consumption decreased overall, Black and Latino children continue to have approximately double the rate of sugar-sweetened beverage consumption when compared to white and Asian children. This is very concerning, considering sugar-sweetened beverages are the leading source of added sugars in the American diet. Excess consumption of added sugars contributes to the high prevalence of childhood and adolescent obesity, and also increases the risk for dental decay, heart disease, hypertension, type 2 diabetes, and death from any cause. Findings in the report showed large regional differences in child sugar-sweetened beverage consumption across the county in 2018, with the consumption lowest in the West service planning area at 16.7%. The West service planning area includes communities like Santa Monica, Beverly Hills, and Malibu. And the consumption was highest in the South SPA at 51.6%. That SPA includes communities like Crenshaw, Linwood, and Compton. And as you can see from this graph, sugar-sweetened beverage consumption has decreased across all 8 service planning areas when comparing 2007 and 2018 data. Among households living below 100% of the federal poverty level, or FPL, 47% of children consumed 1 or more sugar-sweetened beverage per day, compared to 22% of children living in households at or above 300% of the federal poverty level. Sugar-sweetened beverage consumption was also lower among children who participated in the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC, at 32.1%, compared to children in low-income households who did not participate in the program at 40.7%. And this notable difference seems to provide a protective factor that may be due to nutrition counseling to reduce sugar-sweetened beverage consumption, and also that WIC benefits only allow beverages that do not contain added sugar in their WIC package. Public health considers these findings concerning, as the data reflect disparities in sugar-sweetened beverage consumption among racial, ethnic, geographic, and socioeconomic groups. We believe these variations in consumption patterns are likely to be the result of systemic inequities that are outside and beyond individuals' and families' control. Some of these inequities include the marketing of unhealthy foods and beverages and the lack of safe drinking water we find in some communities. Neighborhoods with a higher concentration of poverty and proportion of Black residents may have more outdoor sugary drink advertisements in the form of billboards and convenience store marketing. Research also suggests that Latino and Black children are exposed to more sugary drink marketing than any other racial or ethnic group. Low-income children are more likely to experience limited availability of nutritious food and beverage options due to a variety of reasons that include cost, proximity, or lack of financial resources. Persistent disparities also exist in the availability of safe and appealing tap water in low-income communities. And these inequities may also contribute to variations in water consumption, with some research indicating that the probability of not drinking tap water increased for Black and Latino children following recent water crises, such as the Flint, Michigan water crisis, and consequently, these groups are more likely to consume sugar-sweetened beverages. So keeping in mind that the environment in which children live, study, and play has a huge impact on the choices that they can make. Public health has set forth the following recommendations for environmental and policy changes to address some of these concerning trends. The first is to limit sugar-sweetened beverage marketing in public buildings and spaces. Currently, the advertisement of tobacco products and alcoholic beverages are prohibited within 1,000 feet of places where children learn and play, like schools and parks. This prohibition could be expanded to include sugar-sweetened beverages. The second is to make drinking water safe, accessible, and free, both in schools and throughout local communities. Increased investments are needed to provide safe drinking water access for children through the renovation of water fountains, provision of water bottle filling stations, and, if necessary, adding filtration for potability and palatability, and updating school wellness policies to allow for effective water access throughout the school day, including during class time rather than only during meal times. In California, the Supplemental Nutrition Assistance Program Education, SNAP-Ed, also known in California as CalFresh Healthy Living, works with qualifying school districts and school-aged children from low-income households to improve the school environment by implementing youth engagement projects to increase tap water access and consumption. These projects can be replicated throughout LA County. Another recommendation is to allocate sugar-sweetened beverage tax revenues to programs directed at communities with heavy consumption of sugar-sweetened beverages that are disproportionately impacted by marketing tactics. So taxing sugar-sweetened beverages has emerged as an important policy strategy for addressing the overconsumption of sugar-sweetened beverages. And research shows that sugar-sweetened beverage taxes are associated with higher prices and lower sales of tax beverages. Policymakers have used the revenue generated from these taxes to allocate resources for programs directed at communities disproportionately impacted by sugar-sweetened beverage marketing and consumption. The next recommendation is to implement behavioral economic strategies to promote healthier beverage options in schools and in restaurants. Environmental changes using behavioral economics at locations where children and adolescents are present can support the increased consumption of healthier drink options such as water and milk. For public schools, the Smarter Lunchroom movement focuses on making low or no cost changes to the school cafeteria environment. So for example, there's choice architecture techniques that include the accessibility and presentation of food and beverage items that can increase the number of students who select certain meals, including water and plain milk. So by making some of these items look more attractive, easy to reach. So for example, putting unflavored plain milk in front of the flavored sugary milk, for example, they're more likely to be selected by students. The next recommendation is to urge national school meals programs to ensure access to healthy beverages and discourage consumption of sugary drinks. And just to keep in mind that policy changes that impact school meals programs should be in line with current scientific evidence on sugar consumption and its impact on health. And our last recommendation is to expand evidence-based nutrition education on the negative health impacts of sugary drink consumption by federal nutrition assistance programs. So federal programs like WIC, like SNAP Education or CalFresh Healthy Living are really critical to communicating health messages to people and communities who have high rates of sugary drink consumption. And these federal nutrition education programs can continue to promote and expand community education regarding sugar-sweetened beverages, and alternative healthy beverage options through campaigns such as Rethink Your Drink. With these policy recommendations, we hope to start to really begin to address systemic issues contributing to the health inequities we're seeing in our communities and among our residents. At this time, we're now going to take a few questions, and then we'll continue with the Spanish portion of the media briefing. We may not get to all the questions today, but we'll make sure that we reply to any questions that you may have via email. If there are any further questions beyond the ones that we're able to answer today, please send those questions via email to media@ph.lacounty.gov. Thank you.